The 2019 World Health Day has as a theme universal health coverage. This coincides with what the federal government of Nigeria is trying to achieve in the health sector by ensuring that every Nigerian, irrespective of status, is able to access health care anywhere the person is. Speaking at the commemoration of the day, the Minister of Health, Professor Adewole, says the Basic Health Care Provision Fund, recently launched by President Muhammadu Buhari, is part of the federal government's initiative of providing universal health coverage.
And one of the unique things that this government has done is to put money in Basic Health Care Provision Fund. And for the first time in this of the country, money will flow from federal, a CBN account, to a primary health care facility, where the head of the facility and the community leader will operate the account. Money will not leak out from central bank, but it will flow down. And so it's a unique way to make sure that the PAC survives. They want to repair the pipe, they want to paint the place, they want to buy a few things. They can do so with the money that will come to them quarterly. 50% of this money will also flow in through the National Health Insurance Scheme to take care of expenses so that you don't have to pay out of your pocket. We will also use this to grow the NHIS enrollment. And federal government is rehabilitating some of our tertiary centers.
On the recurring outbreak of Lassa fever, Professor Adewole notes that in no distant time it will be contained, as there are ongoing efforts to achieving the objective.
The problem with Lassa fever is that in the first 7 days it is treatable with an antibiotic, which we have. But if you then delay beyond 7 days, complications set in and it becomes difficult to manage. So what we are doing include the following. One, to improve early recognition. We are also training our doctors, healthcare professionals, that not every fever is malaria. And secondly, we now have technology that we do not have to treat malaria without confirmation. Science is working hard. There are attempts to devise vaccines for Lassa fever. So a lot is going on. And I can assure you that in the next few years, we will see an end to Lassa fever.
The officer in charge, WHO Nigeria, Dr. Rex Impozanje, commends Nigeria for prioritizing revitalization of primary health care centers as a tool for achieving universal health coverage.
And we listen to the video. Universal health coverage ensures that everyone, no matter who they are, no matter where they live, no matter when they need it, can access essential quality health services without facing financial hardship. Hence, it is hence noteworthy that Nigeria has prioritized primary health care and revitalization as a main strategy towards achieving universal health coverage.
The implementation of National Health Act is a major milestone in the achievement of universal health coverage, although Nigerians are still expecting to see a day where their medical bills, irrespective of the cost, will largely be taken care of by the government. Joseph Kadiri, ITV News, Abuja.